Hi, it's Dr. Elizabeth Baus from Integrated Health Solutions, and today we're going to talk about dry needling, what it's about, why it's different than acupuncture. And I'm going to show you some of the tools that we use here every day so that you can see what goes on at Integrated Health Solutions. So first off, this is what one of the filaments looks like. As you can see, it's super tiny, almost like a thread or a piece of hair, and it's bendable. These are one-time use and then they're thrown away. We don't use them again. We often use them with TENS here. So this is a TENS unit that we use. It has like little alligator clips that clip on, and there's a red side and a black side. And so we connect after we've dry needled the trigger points, and that helps release the tension. It's a little bit more effective than dry needling just on its own. So today we're also going to go over the reasons that you might use dry needling. So we use it primarily to neutralize electrical activity in the muscle. So what I mean by that is, when a muscle is overactive, it might have trigger points in it due to the overactivity, but you're also going to have muscles that will have trigger points due to underactivity. So an easy example for the low back, for example, would be the erectors in the lowest part of the low back might be overactive and have trigger points and tension there that dry needling can help reduce. But the glutes might be underactive and you might have pain and trigger points there as well, and dry needling with TENS will get that muscle to relax. And then when we go to do the rehab, it fires better. It's easier for the brain to connect to the muscle and it fires more appropriately. It just basically, whether it needs to be ramped up or ramped down, it helps make it more normal tissue, okay? There's also a couple of reasons why people wouldn't get TENS or wouldn't get dry needling. So one of the only contraindications really for dry needling would be if you're on a significant level of blood thinner. And then we usually, like if somebody has a cardiologist, I would just talk to the cardiologist and they would say whether it was a good idea or not for that person. And also the TENS unit, since it's microcurrent, we don't use that on people who have a pacemaker. And we also don't use that on pregnant people. We just use that on pretty much everybody else because it does amplify it, but those are two reasons why you wouldn't use it. So when we're treating at IHS, we typically do the dry needling first to get rid of as much tension as possible and to activate muscles that aren't as activated as they should be. Then we do soft tissue work and adjust as needed. Muscles are as relaxed as they're going to be, so we get a better adjustment. And really everything is driving the rehab. So that's why the TENS is so great for muscles that are a little more inactive, as it helps kick them on and it helps make it easier for you to do the exercise appropriately, which is how you get out of pain and stay out of pain. So if you've never been dry needled, it often doesn't hurt. A lot of times people don't feel it at all. It's sort of anticlimactic, I think, than what they were expecting. But also, sometimes you do feel it, and if you do, it feels to me like a little pinch, and it's just instant and gone, okay? So if people feel a little pinch and it lingers, it means the skin's a little irritated, and we just redo it, take it out, and redo it. And then the other thing that you can get is called a twitch response, which is a really great thing in acupuncture and dry needling. And it's where if you hit a trigger point just right, instead of letting go slowly, it sort of does a little jump and lets go all at once. Now this is local, so it happens in a pretty small area, but it's just a little twitch or a jump, and then you get a better release. So they're considered a good thing. It's just a little bit of an odd feeling if you haven't experienced it before. So dry needling is one of our favorite tools that we use here at IHS to help people rehab their way out of pain and have lasting results. Give us a call or click the link below. If you want more information, you can click on our page and reach out for an appointment.